give your applause to each of these awardees. My first comment that I wanted to make was to thank the awards committee for their hard work. Many people were nominated for these awards by your colleagues, and it's always difficult to narrow that list of nominations down to one or two people. On the committee, I'd like to thank Maureen Lichfeld, Mike Reed, Peter Berman, Nancy Reynolds, Phil Landrigan, Nelson Siwancambo, Jaimina Gazan-Villalba. Thank you very much for all your help in working through all the nominations. I'm now going to turn the podium over to Dr. Zoe Mullen, who will make the awards to the CUGH Poster Student Awardees. Zoe. That's the run of show.
Thank you. Good afternoon, everyone. It's a great pleasure to be here announcing the winners of the most important category in the awards ceremony this afternoon, the CUGH Student Poster Awards. So there's a few to get through, so I'm going to whiz through. If I could ask each individual to come up here, receive their certificate, and then remain with me on the stage. We'll have a joint photograph afterwards. No time for speeches, I'm afraid. So the first winner for the project entitled The Socioeconomic Burden of HPV-Related Diseases on Patients in Vietnam is Jessica Komorowski from UT Southwestern Medical School in Dallas. Second up, for a project entitled End User Experiences of an Electronic Health Records Platform in a Tertiary Hospital System in Kenya, is Anmol Shrestha from California Institute of Science and Medicine. Our next awardee, unfortunately, wasn't able to make it, but for the project entitled Global Health Student Ambassadors, an innovative approach to strengthen reciprocal exchange partnerships, is Roba Abusaway from Dell Medical School at the University of Texas in Austin. If we could just give them a round of applause, please. Well done to them. Next up is a project entitled Geospatial Distribution and Environmental Determinants Affecting Malnutrition Among Under 5 Children in Ghana and Kenya, and that goes to Rachel Maynor from the Aga Khan University Hospital in Nairobi, Kenya. Next up, for a project entitled Exploring the Infection Prevention and Control Measures Taken by Traditional Healers in Rwanda Partnerships, is Marie Immaculée Dusingize, I hope I did that justice, from the University of Global Health Equity in Rwanda. Congratulations. The next winner for a project entitled Early Use of Professional Interpreters Improves Trauma Outcomes is Sydney Bertram from Medical University of South Carolina in Charleston. Well done. And our last winner, and for reasons that I'm unable to explain, but we will resolve this as soon as possible after the ceremony, I don't have a certificate, but the last winner for a project entitled Neuroepidemiology Training Programs for Early and Mid-Career Researchers in Bangladesh is Famida Rashid from the Sam Houston State University in Huntsville, Texas. Okay. Yeah, on the line. Can we stand on the line?
Next, I'd like to introduce Dr. Nancy Reynolds, Chair of the Board of CUGH, to introduce the awardee for the most Distinguished Leadership Award. Nancy.
Thank you. We are very proud to announce that Brandon Court, MD, PhD, research scientist at the George Washington University, is this year's award recipient. Dr. Court is a renowned psychiatrist and anthropologist with 25 years of experience improving mental health services in countries affected by conflict, disaster, and adversity. He holds the Charles and Sonia Ackman Professorship in Global Psychiatry, and he directs the GW Center for Global Mental Health Equity. His global work includes collaborations with the World Health Organization, UNICEF, and other humanitarian organizations. As the academic partner lead for the WHO UNICEF EQUIP initiative, Dr. Court has been instrumental in establishing global competency frameworks for mental health care providers. His research focuses on developing mental health assessment tools, reducing stigma in healthcare settings, and improving the quality of mental health services worldwide. Please join me in congratulating Dr. Court.
Nancy. Yep. All right. I'm going. You get to speak.
Well, what a time to get a leadership award in global health. I thought this was the stage of my career where suddenly my students and my trainees go off and do the hard work and I get to sit back. But I voted with Nelson Sawankumbo on the last session, so I got a lot of work to do. I'm deeply honored to receive this award from CUGH and grateful to my staff who generously put forward my nomination. To say it's a difficult time in global health is a grand understatement. Every day we are witnessing preventable health atrocities. Needless suffering caused not by the lack of knowledge or capacity, but by decisions that strip away the rights and structures to provide health care to those in need. We've been hearing a lot about the devastating impacts in HIV, in reproductive health care, but as a psychiatrist, I want to take a moment and share also the impacts in mental health. I was talking to a colleague in Uganda recently, Dr. Byama Mutamba, who is one of the directors at the Budibika National Hospital in Kampala. His methadone clinic was shut down. And if you want to talk about a medicine where every single day matters, it is methadone. One day missed can be fatal. His clinic served 700 patients, with 200 coming every single day for their methadone. When the services stopped, there were immediate withdrawals, relapses, and overdoses. Another colleague with Strong Minds Uganda described 15,000 people in psychological treatment who were suddenly left with no care. And this mental health impact goes beyond those who lost direct services. The job terminations, economic uncertainty, closures of schools, and dismantling of security programs compound into a rapidly growing mental health crisis. But the very systems that I myself have spent 25 plus years helping to build cannot respond to those mental health needs because they're being prohibited from acting. And there's another crisis, the unknown future for the next generation of global health practitioners and researchers. My students show up in class with fear and despondence. Last summer, I brought trainees to Washington, D.C. to explore careers in global mental health. We went to USAID, PAHO, FHI 360, the U.S. Institute for Peace, NIH's Center for Global Mental Health Research, but those career paths are now in jeopardy. Their future professional homes are among the institutions most under attack. But I think what saddens me and frightens me most is not that just we're facing a crisis of funding, that's happened before, though not to this scale, but we're facing a full-scale assault on basic human empathy. It's an empathicide where suffering is being ignored, dehumanized, and weaponized. But we must not let our empathy be snuffed out. We must remain emotionally connected to each other and those we serve. Over the past few weeks, every class I've taught begins with a check-in acknowledging the emotional impacts of this crisis. Every meeting with colleagues around the world has centered on maintaining and strengthening our connections. Our Center for Global Mental Health Equity at GW has teamed up with advocacy groups to document the impact of funding cuts for mental health so we can develop public messaging and identify stopgap measures to provide services. I find hope in these collective efforts. I find hope in the students who email me and say they still believe in the mission of global health, and the colleagues who are finding ways to restart medications and restart psychological services. And I find hope in organizations like CUGH, which I know will continue to advocate for students, colleagues globally, and the communities most affected. Leadership in global mental health today means continuing to fight, not walking alone, but doing this together. It means standing in solidarity, advocating fiercely, and ensuring that no one, no student, no colleague, no patient is left behind. So let's all refuel our empathy here at CUGH and march onward together. Thank you very much.
Congratulations. All right, I'd like to call to the podium Dr. Nelson Siwakambo, who will present the Dr. Thomas Hall and Nelson Siwakambo Mid-Career Leadership Award.
So, ladies and gentlemen, let me present to you Dr. Thomas Hall, Dr. Nelson Siwakambo Mid-Career Leadership Award. And for this year, it goes to Dr. Adrian Gardner, Director of IU Center for Global Health Equity in the United States. Adrian Gardner, MD, MPH, is Associate Dean for Global Health at Indiana University School of Medicine. He's Director of the Center for Global Health Equity and Executive Director of the AMPATH Consortium, a global health partnership spanning Kenya, Ghana, Mexico, and Nepal. Dr. Gardner joined Indiana University in 2012 as Executive Site Director for AMPATH in Eldoret, Kenya, where he collaborated with Kenyan leadership on strategic decisions and provided patient care at Moi Teaching and Referral Hospital and at AMPATH HIV clinics. Since becoming AMPATH's Executive Director in 2020, he has expanded the consortium's partnerships to 4 locations. A graduate of Alpert Medical School of Brown University, Dr. Gardner completed his residence and an infectious diseases fellowship at Beth Israel Deaconess Medical Center and earned an MPH from Harvard. He first engaged with AMPATH in 2001 as a medical student and later served as AMPATH team leader in 2006 to 2007. In addition to his global health work, Dr. Gardner provides infectious diseases care at Eskenazi Hospital, Indiana's largest public hospital. That's the gentleman I'm presenting to you. This.
Is he here? Oh, there he is. He's coming. That's for him. Yeah. Adrian, congratulations. Yeah. No, we did.
All right.
I next want to invite up my dear colleague, Dr. Judy Wasserheit, who will present the CUGH Wasserheit Young Leader Award.
Thank you, Tom. It is an honor to present our two CUGH Young Leader Awards for this year. One of them goes to Emily Sheldon, who is the co-founder and CEO of the African Health Innovation Center in Ghana. Emily is passionate about using market-based approaches to solve complex global health challenges. Her global development experiences span sub-Saharan Africa, and she has worked in facilitation and training, capacity building, and program design. As I mentioned previously, she was the co-founder and CEO of the African Health Innovation Center, which is a Ghana-based non-governmental organization dedicated to using innovation and entrepreneurship to improve health outcomes. Before establishing the center, Emily served as the Director of Health Innovation for Impact Hub Accra and also as Africa Regional Lead for the Impact Hub Global Team, driving strategy and business development throughout the continent. She has worked in the nonprofit, for-profit, and consulting fields with major focus on process leadership, project management, and strategy. Emily holds a Master's of Public Health with a concentration in global health from Vanderbilt. And so, where is she?
Yeah. There she goes.
Ah, good.
That's for you.
There
to
we
do.
go. Come on up here.
Yes.
Congratulations. All right, I think you go between the two of us,
Between
huh?
us. Congratulations.
That goes to you.
Yeah.
I am also delighted to present our other award for young leadership to Ronald Olam, who is a research associate at Makerere University School of Public Health in Uganda. Dr. Olam is a physician who does research in infectious disease epidemiology, implementation science, and emerging and re-emerging infectious diseases, three areas that actually are very close to my heart. He has worked with special interest in HIV, tuberculosis, as I said before, emerging and reemerging infectious diseases. He previously served as an external reviewer for the WHO Europe Pocket Handbook for primary health care for children and adolescents, and as a technical advisor for the UNESCO, UNICEF, WHO Global Status Report on School Health and Nutrition. Dr. Alam has also supported the Lancet Global Health Commission on medical oxygen security and has consulted for multiple organizations. As a sign that he is a real rising star, this, in fact, is his second CUGH Young Leadership Award. In 2024, he received the Dr. Anwar and Pari Velji Young African Leader Award for his commitment to improving global health outcomes in low-income settings through research and advocacy. So, great, thank you.
Down there, left side. There he is.
Ah, good. We found him.
We have a very special award next, which Dr. Elsie Kiguli Malwadi will introduce. This is a new award.
Good afternoon. I have the honor to present the Dr. Alfred Muteta Award to Professor Nelson Sewankambo, who is very well known to all of you. And to summarize his CV in 1 minute is an uphill task. And I'm privileged that he was my teacher and mentor. So Professor Nelson Sewankambo is the president of the African Forum for Research and Education in Health. He's Professor Emeritus and a former Dean of Makerere Medical School in Uganda and past principal of the Makerere University College of Health Sciences. He facilitated establishment of many collaborations between Makerere University and institutions in both high and low or middle-income countries. He was a member of the research team that for the first time identified and documented the existence of HIV in Uganda in the early 80s, and he codenamed it Slim disease, and that's how it is known actually in Uganda. He's one of the founders of internationally renowned Rakai Health Sciences Program, initially known as the Rakai Project, which has a longitudinal population Rakai HIV community cohort services for the last 35 years. RHSP has generated research evidence used in global health by WHO, regional and national HIV prevention and management policies. He's one of the founders of the world-famous 20-year-old Infectious Disease Institute at Makerere University in Uganda. IDI has very strong HIV prevention, research, management, and care programs for the last 20 years. He was a founder and is scientific advisor for 20 years plus of the Makerere University Walter Reed Research Institute, and a founder member and board chair of Makerere Joint AIDS Program in Uganda. He has focused on epidemiological and interventional HIV/AIDS research, and so contributed to the building of indigenous research capacity to conduct quality research relevant to the country, to the region, and also globally. Professor Sewan Campbell, please come and receive your.
That's for him. Congratulations. Thank you. I gotta go. You get it? Stay up here. Nelson. Stay up here. Stay here. Because we have another award. So next, I'd like to invite Dr. Georgina Yebula and Nelson to join you to give out the Dr. James Hakim Award. Georgina.
Hello, everyone. Our special award for the James Hakim Global Health Award, sponsored by AfriHealth, CUGH, and Fogati International, goes to Adani Tesega. Please, Adani, if you are here, would want you to be up here whilst we read your CV. Dr. Adani Tesega is Assistant Professor of Public Health in the Institute of Public Health, University of Gondar, Ethiopia. He is a postdoctoral fellow in digital health with JSI-USID at the University of Gondar, leading research on the information revolution's impact on maternity care in Ethiopia. He previously held a short-term fellowship at Harvard T.H. Chan School of Public Health, focusing on pediatric infectious diseases and nutrition. Since 2020, he has been an assistant professor in public health and health service management, deputy director of the Institute of Public Health, and regional hub coordinator of the International Institute of Primary Health Care Ethiopia. His PhD research examines dietary practices in young children and their health impacts. With over 35 publications, his expertise spans health systems, maternal and child health, and nutrition. Ladies and gentlemen, we want to give the award to Dr. Adani Tesega. And this is a very special award.
Thank you, Virginia. Thanks, Georgina. Thank you, Elsa. Thanks, Nelson.
So next I want to invite my colleague here, Dr. Keith Martin, who will go through the Dr. Velji awards. Is he, Anvar, coming up?
Yeah, he's
Yeah?
Anvar's here.
Anvar, Dr. Velji. Oh, there he is. Please.
Thank you. Before my friend Dr. Tom Quinn runs away from the stage, which he normally does by this time, I'd like to thank him profusely for all the work he's done over the years in guiding us through the awards and finding all the right people to get the awards, to put it a little diplomatically. Thank you so much.
Thank you for the honor.
And I also want to thank Dr. Keith Martin, who has been a tremendous friend to us for all these years, and his leadership. And you have seen what his leadership can accomplish. Thank you so much on my behalf and my wife's behalf, Pari Velji. Our first awardee, I believe, is not here today, but he has won the CUGH Student Leader in Global Health Award. And his name is Prajabal Luitel. He's a final year medical student at the Tribhuvan University Institute of Medicine in the medical campus of Kathmandu, Nepal. He's a final year medical student and at the institute, and he has achieved a lot during his recent journey, from being a student editor of an international journal of medicine for the students. And he's in the advocacy committees for Association of Academic Global Surgery. He has a tremendous interest in surgical future. He also has served as a trainee co-lead for the Association for Surgical Education and the Society for Improving Medical Professional Learning series. His research focuses on capacity building for surgical care and currently is a leading grant-funded project, Female Community Health Volunteers led Congenital External Genitourinary Anomalies Identification and Referral, which is a pilot assessment in rural Nepal. And he has over 40 PubMed indexed peer-reviewed publications and the founder of Researchify.net. He's in the new AI generation, as you can tell. And he's passionate about addressing the lack of research mentorship in developing countries. I think we can all help there. And it is my congratulations to him and his family for this general award that he has won. Our next awardee is a Leader in Global Health Award, which is a faculty award for 2025. And the recipient is Bach Xuan Tran. He is a professor and vice head at the Hanoi Medical University. Dr. Bach Tran is a professor at Vietnam National University, Hanoi, and adjunct professor at Johns Hopkins. He has extensive experience in consulting for United Nations agencies, international organizations, and governments across Asia. His work focuses on cost-effective interventions, health service evaluations, and system strengthening in areas such as TB and HIV, substance abuse, mental health, pandemic response, all very current interests that we all have. He has received numerous international research awards, including the 2024 IBTN LMIC Investigator Award. Please welcome Dr. Tran. And there is much more to read, but we are short of time. Dr. Tran. Thank you. Tom, I need you in the picture. Don't be shy.
Thank you so much.
Congratulations.
Yeah, thank you. Congratulations.
Thank you so much.
Now you're in the back.
Yeah.
I don't know what's going on. What's the button? Wow, all right. My tummy shows, sorry. Postprandial. Thank you.
Thank you so much. Congrats. Yeah. Oh, Bar. Yeah, keep going.
Our next awardee is Dr. Carol, and she's also a professor, of course. Carol Waggett, and she's a professor and chair of Global Health Studies at Allegheny College, University of California, Berkeley. And she's also the chair there. And she has a lot of interest and is a leader in interdisciplinary and educator and scholar focused on the international and intersex natural and a lot of planetary health experiences in between. And she is also a co-founder of Global Health Educators Community, which is very close to what our previous institution was, which was GHAC. But hers is GHAC Co. People often misunderstand between the two. She provides training and innovative pedagogical resources for global health education. She has led the development of Allegheny College's global health programs and collaborates globally through CUGH, ASPPH, ASCNU, and the Planetary Health Alliance. Please welcome Dr. Carol Waggett.
There you go. Congratulations.
Congratulations. Found solutions. Thank you.
Congrats.
The last one isn't here, okay? The CUGH Young African Leader Award goes to Solomon T. Wafulu, who is a research associate at the Makerere University School of Public Health in Kampala, Uganda. You should know this place by now, and you should visit Kampala and Makerere. You know, all the famous people are here. Solomon Wafulu is a public health scientist and a research associate in the Department of Disease Control and Environmental Health. And he holds a BSc in Environmental Health and a Master's in Public Health, et cetera, in Manchester and everywhere else. Too many to tell you about. In addition to his academic role, Solomon also works as a coordinator for the development tools for action at the Center of Excellence for Sustainable Health. And he has successfully supervised over 20 undergraduate and postgraduate dissertations. Remember, he's a young person at the present time, and has authored more than 65 publications. He is also an active manuscript reviewer for over 20 journals and reviews grant applications for the Royal Society of Tropical Medicine and Hygiene and the Wellcome Trust. Solomon has presented his research at numerous national and international scientific conferences. We would like to congratulate Solomon Wafulu and his family for this great achievement. Thank you. And he is not here today to receive this award. Thank you. I think this is the other one is yours.
Thank you very much, Dr. Velji. For all of you who are not aware, Dr. Velji is one of the founders of CUGH. He was one of the people, absolutely. And he, with individuals like Dr. Judy Wasserheit, Dr. Tom Quinn, founded, actually, was a merger between GHAC and CUGH, and what was born out of that is CUGH combining education and research into what we are today. And I just, and on behalf of all of us at CUGH, to you and Pari, thank you very, very much for your enduring support of these awards that you have done for so many years. It means so much to so many. So thank you. So one of the things we want to do is how do we actually get our messages out in a different way? How do we actually do it visually? So what we've done is we created these video awards, and we asked the question, tell your story, but do it in a clever video. And you'll be able to see them in those chairs that are outside. We have those videos, plus a number of really impactful short videos from partners of ours like the Center for Strategic and International Studies in Washington. So here are the winners of the Global Health Video Competition Awards that Dr. Quinn and I will be happy to award. The first awardee is the Auto Aspira team, is the winner of the Global Health Challenges category. Yuron Lee will accept the award. The co-winner of this, though, is for High Impact Programs category is Ganiv Singh. And then the third winner for Infectious Diseases Research Collaboration Group, the co-winner is High Impact Programs category. They're not here today, but the Infectious Disease Research Collaboration Group was the co-winner in the High Impact Programs along with Ganiv Singh. So if we have Yuron Lee, the award winner for the Global Health Challenges category, and Ganiv Singh, the co-winner of the High Impact Programs category, if they could come up, we will present you with your awards. Congratulations. The next award is with a partner of ours, the Untold Stories in Global Health. It's a real pleasure to introduce you to Dr. Brian Simpson. And is Dana Myers, is she Dana here? Oh, Dana, come on up, Dana. Yeah, no, come on up. Okay, all right. Well, Brian and Dana do this amazing job with these awards. And please take a look at Global Health Now, which is an unbelievable source of information on what's going on in global health. And they're housed in Johns Hopkins. So really much thanks to Brian and Dana. You do an amazing amount of work, and we're grateful. Brian.
Okay. Thanks, Keith. I believe we have a couple of the winners here in person. If you are here, please come forward. The Untold Stories contest has been going on for 10 years. It's a joint effort between CUGH and Global Health Now. And together we seek to elevate issues that need greater awareness and solutions. This year we had an astounding response. We had 169 entries from CUGH members and Global Health Now readers from all over the world. We have already assigned 5 Untold Stories articles to journalists, and will continue to assign and publish more articles and commentaries throughout the year. I'll now honor this year's winners. Doreen Smart for The Hidden Crisis of Unsafe Abortions in Tanzania, and Catherine Quibel for Latinas Seeking Cancer Care in California's Central Valley. The honors great to those winners. Thank you. And our honorable mentions are Christian Nitizimira for Unmet Palliative Care, A Global Health Crisis in Compassion, Sante Leandro Baldi for Pemba, Where Oral Health is Silently Ignored, Padmathi Krishna Kumar for Hazards Faced by Firecracker Workers in Sivasaki, India, Christina Pantzer for child substance use among Quam Toba of northern Argentina, Nina Cherrieth for Hikikomori in Japan, Anusha Maharaj for mental health of LGBTQ+ individuals in Caribbean countries, Michael Musenga for victory in Zambia making dental amalgam-free country, Taser Fameh for Ageism in Egypt, and Alice Balratelli for Infection Prevention and Control IPC Practices in Healthcare Settings in Pakistan, and Rosalind Davor for Illegal Alluvial Gold Mining in Ghana. So thanks to our winners. I don't think we have them actually in person.
Alice?
Alice? Oh, here they are.
Alice,
Okay, great.
Nina,
Yes, come on
and
up.
Catherine are here.
Yes, okay.
Hi,
Great.
I'm Alicia.
Alicia. Of course, Alicia. Mille grazie. Okay, fantastic.
Congratulations.
Yes, thank you. Yeah.
Oh, great, man. Yes, congratulations.
Catherine, well done. Nina? Congratulations. Well done. Well done. There you go. Come on. Roll. And do follow this stories on Global Health Now, because it's an amazing collaboration where Brian and Dana have actually got journalists to dive more deeply into these amazing stories. I have to tell you, when we put out this call for Untold Stories, it is a jaw-dropping number of applications. We probably get about 200, right, Brian? 150, 200? Yeah, and if you go through them as we do, you go, okay, here's about 100 stories that would be amazing to tell. And so we got to figure out a way to get these things in the public space, because they really have huge implications for public policy. Next, we have reflections. Reflections in Global Health Essays. And Dr. Jenny Bainsinger is going to make the presentations for that. Dr. Bainsinger.
Hello. I have the great pleasure of inviting our awardee recipients up here and announcing the awards of our CUGH Reflection Contest. This contest was started in 2013 with the goal of fostering a culture of self-analysis, critical reflection, and cultural humility within the global health community. Submissions may be essays, photographs, videos, AI-generated images, as we had this year, or any other type of submission by trainees, faculties, practitioners of any kind. So in our faculty and practitioner category, I'd like to announce Alice Bartatelli with her essay, A Cup's Perspective. A couple of our trainees couldn't be here. Christopher Ducott is in Nigeria. His essay was called Global Health is All About Touching Lives. The next is Kyle Nguyen with his essay, Why Being Shirtless in the Dominican Will Make Me a Better Doctor. Our honorable mention category had 4 recipients. One who is here with us today is Alia Pedersen and Lauren Contreras with their essay, Bridging the Silence. And the other honorable mention candidates were Katrin Kelly with her essay, Balancing Measures, Frank N. with his essay, Infectious Conversations, and Anastasia Prost with her essay, Working Towards Positive Freedom. I'd like to congratulate all of them together. Thank you.
Thank you very much, Jenny. And just also a big shout out. I don't know if Dr. Thuy Bui is here or Dr. Jessica Evert. Are you here at all, Thuy, Jessica? Well, Dr. Bui and Dr. Evert have really been fundamental to this exercise, Reflections in Global Health, and they have published it in a book. So if you have a chance, look it up on Amazon, get the book, Reflections in Global Health. It's really an inspiring collection of stories that we've been doing, what, more than a decade? Yeah, more than a decade of incredible stories from students on their reflections in global health, so it's inspirational. And it's a pleasure to call back to the podium Dr. Nancy Reynolds, who will do our last presentations before Dr. Quinn makes the closing comments. Dr. Reynolds.
Thanks, Keith. And it's my great pleasure to acknowledge our outgoing CUGH board members who have really made such wonderful contributions, especially our outgoing chair, Maureen Lichtfeld, and our treasurer, Phil Landegren, who both of them are not here today, nor is a couple of our other outgoing members, Charles Imanjira and Lisa Hirschhorn and Samuel Omadoyan. But I am very pleased to be able to acknowledge the contributions of Sima Mahmood, who I believe is here. Oh. Is she here?
CMAP?
Yeah.
She should be. Yeah.
Oh.
Is CMAP here?
I was told she would be here, but it looks like she is not.
CMAP is. Okay.
Okay,
there
well, I
you
guess
go.
not. Well, we'll give them an applause anyway. Thank you.
Thanks.
Good to see you. Yeah.
Thanks.
Let me close it. Yeah. So it is late and unusual for me. I'm going to be very brief. I want to congratulate all the awardees for the different various topics that have been covered. I want to give a shout out to the awards committee. As I mentioned in the very beginning, it is not easy to look at all these resumes and nominations to actually narrow it down to one or two awardees. But the committee worked very hard to accomplish that task. Again, it was Maureen Lichtfeld, Mike Reed, Peter Berman, Nancy Reynolds, Phil Landrigan, Nelson Siwankambi, and Jimenez Garzon Villaba. My many thanks to them and to CUGH for honoring all these individuals with the plaques and its organization of this presentation. Without further ado, this session is now closed. Thank you.